And speaking of the topic of mental health, if you weren't aware, May is actually Mental Health Awareness Month. So joining us this morning, we have our psychotherapist, human behavior expert, family therapist, Dr. Karen Ruskin, joining us to talk about mental health. And it really is so dependent on your age and where you are in your life, right, Dr. Karen?
What's amazing is that when it comes to mental health, mental challenges, stressors, reacting to those stressors can happen at any age, but there is a big difference between actually being diagnosed with a mental illness versus going through a hard time and not feeling well mentally. But it doesn't mean that your challenge is any less worthy of having someone to talk to. So for an example, whether it's relationally or individually or professionally, these are all examples in which can affect how we're feeling mentally in terms of our mental health and wellness.
So you put together kind of these bullet points for us, and I mean, when it comes to your personal health, relationship health, professional health, and all those various things, I mean, do you see variations in terms of where people are in their life stage or their age?
Right, so depending on one's life stage, their age, what they've been through, their tools of coping and development, everything can affect your mental health. But it's not that you are free of having some type of challenge or reactive response based on an age or a gender or a life stage. And you know, you mentioned how I put out these tips. Before I even go into the meat of the tips, I really want to talk to the viewers right here, right now. I want to share with you, it's so important to implement the EG formula. EG, okay? E stands for every day, and G stands for generosity. So if every day we are generous with ourselves and patient with ourselves and give ourselves love in terms of communication and awareness of what we're feeling, if every day, the EG formula, we give our relationship its time and its energy, and we're aware of what we're feeling, whether it's our professional work and recognizing what we're passionate about and giving everyday generosity to work, generosity to friends, everyday generosity to our relationship and our own mental health in terms of our mind and our body.
Okay.
Everyday generosity.
Okay.
EG, the secret formula for mental health and wellness.
Okay.
That's it. So you guys got that, right? You and me. Yeah.
And yeah, I know you put together some bullet points in terms of tips, you know, I guess beyond EG, which is a very important thing, absolutely. But you talk about taking ownership, for instance.
Yes. So within EG, if you take ownership of what you're feeling and acknowledge it, and you have awareness of what you're feeling, of your mind and your body, because remember, how you think affects how you feel, which affects how you act. So if you are aware of how you're thinking, and aware of how you're feeling, and aware of how you're acting, and if every day you have generosity for yourself, and you take ownership of what actionable items you can take. For example, taking care of your body affects your mind. Taking care of your mind and your emotional health and being honest with yourself about what you're feeling. Connect with your loved ones or friends, someone you trust, and share the depth of what you're feeling. That connection, that sharing, whether it's about tips relationally or individually or professionally, and you take ownership of that, then you will feel well emotionally. You may hurt, you may experience loss or pain or grieving. It's not about never feeling feelings. That's the thing, that's the myth. It's not about not feeling, it's about taking ownership of those feelings.
Gotcha. Well, thank you so much, Dr. Karen Ruskin, joining us this morning.